The unit used to measure radiation dosage is the REM, which stands for Roentgen equivalent in man. It represents the amount of radiation needed to produce a particular amount of damage to living tissue. The dose of REMs determines how much harm a person suffers. High radiation doses tend to kill cells, while low doses tend to damage or alter genetic code of irritated cells. High doses can kill so many cells that tissues and organs are damaged immediately. This, in turn, may cause a rapid body response, often called acute radiation syndrome. The higher the radiation dose, the sooner the effects of radiation will appear, and the higher the probability of death. This syndrome was observed in many emergency workers responding to the 1986 Chernobyl nuclear power plant accident. Approximately 134 plant workers and firefighters battling the fire at the Chernobyl power plant received high doses of radiation, 80,000 to 1,600,000 mREM, and suffered from acute radiation sickness. Of these, 28 died within the first 3 months from their radiation injuries. 2 more patients died during the first days as a result of combined injuries from the fire and radiation. But how does radiation affect individual parts of the human body? The hair. The losing of hair quickly and in clumps occurs with radiation exposure at 200 REMs or higher. The brain. Since brain cells do not reproduce, they won't be damaged directly unless the exposure is 5,000 REM or greater. Like the heart, radiation kills nerve cells and small blood vessels and can cause seizures and immediate death. The thyroid. The thyroid gland is susceptible to radioactive iodine in sufficient amounts. Radioactive iodine can destroy all or part of the thyroid. By taking potassium iodide, one can reduce the effects of the exposure. The blood system. When a person is exposed to around 100 REMs, the blood's lymphocyte cell count will be reduced, leaving the victim more susceptible to infection. This is often referred to as mild radiation sickness. Early symptoms of radiation sickness mimic those of the flu and may go unnoticed unless a blood count is done. According to data from Hiroshima and Nagasaki, show that symptoms may persist for up to 10 years and may also have increased long-term risk for leukemia and lymphoma. The heart. Intense exposure to radioactive material at 1,000 or 5,000 REMs would do immediate damage to small blood vessels and probably cause heart failure and death directly.